Yeah, hi everyone. Welcome to my channel. My name is Dr. Wan, and today our topic is UTI. UTI stands for urinary tract infection. I have to dedicate my time to prepare this clip because I've seen that there is a misuse of medication globally, not only in Africa. So I choose to dedicate this time to make this video, or call it clip, to actually emphasize on this particular topic, the particular pathology, and also how to manage it. It's a shame that we have gone to school and some of us still do not know how to prescribe medication. UTI is quite common in women. I can assure you that every lady goes through this situation at least twice a year. So you can imagine how many women are in this situation that are not being informed, or are not being trained, or the physician or colleague whosoever might not be prescribing the right way. So I'm here to give kind of a roadmap, or call it a therapeutic guide on what to do. So let's look at what is UTI in the first place. Then we can go from there. So UTI stands for urinary tract infection. A urinary tract infection is an infection in any part of the urinary system. The urinary system includes the kidneys, ureters, bladder, and urethra. Most infections involve the lower urinary tract, that is, the bladder and the urethra. Women are at greater risk of developing a UTI than men. If an infection is limited to the bladder, it can be painful and annoying. But serious health problems can result if a UTI spread to the kidney. Healthcare providers often treat urinary tract infections with antibiotics. You can also take steps to lower the chance of getting UTI in the first place. So that was just the introductory part, and now let's look at the symptoms. UTIs don't always cause symptoms. When they do, they may include a strong urge to urinate that doesn't go away, a burning feeling when urinating, a urinating often and passing small amounts of urine that looks cloudy. So you need to be very careful here. When you are urinating, you see this kind of foam, or we call it froth, building up inside your bladder. So know that that's the situation. Urine that appears red, bright pink, or color, signs of blood in the urine. Strong smelling urine, pelvic pain or flank pain in women, especially in the center of the bladder and around the area of the pubic bone. In older adults, UTIs may be overlooked or mistaken for other conditions. Now, having said that, there are types of UTIs, types of urinary tract infection. Each type of UTI may result in more specific symptoms. The symptoms depend on which part of the urinary tract is affected. So let's take, for instance, the kidney. So if it's the kidney, definitely you will experience what we call back or side pain, or with some books call it flank pain, heavy fever, shaking and chills, nausea and vomiting. For the case of the bladder, you experience what we call pelvic pressure, lower belly discomfort, frequent and painful urination, blood in urine. Whereas for the urethra, you will have just two symptoms, that is burning with urination and discharge. Now, having said that, you will definitely need to take an appointment to see a healthcare professional who is trained in that area. And if things don't improve, then you will see a specialist like a gynecologist for women to understand what is going on. And for men, I will say you see an andrologist or a urologist to make sure things are okay. Now, let's look at the causes. UTIs typically occur when bacteria enter the urinary tract through the urethra and begin to spread in the bladder. The urinary system is designed to keep out bacteria, but the defenses sometimes fail. When that happens, bacteria may take hold and grow into a full-blown infection in the urinary tract. The most common UTIs occur mainly in women and affect the bladder and urethra. Now, let's look at infection of the bladder. This type of UTI is usually caused by Escherichia coli, or we call it E. coli. E. coli is a type of bacteria commonly found in the gastrointestinal tract, GI tract, but sometimes other bacteria are the cause. Having sex also may lead to a bladder infection, but you don't have to be sexually active to develop one. All women are at risk of bladder infections because of their anatomy. In women, the urethra is close to the anus, and the urethra opening is close to the bladder. This makes it easier for bacteria around the anus to enter the urethra and to travel to the bladder. Now, infection of the urethra. This type of UTI can happen when GI bacteria spread from the anus to the urethra. An infection of the urethra can also be caused by sexually transmitted infections. They include herpes, gonorrhea, chlamydia, and mycoplasma. These can happen because women's urethra are close to the vagina. So you see how why is so common in women than in men. And also the way you clean your private part also matters in this case, so be careful. Say for instance, do you clean your private part going downward or upward or cyclical? So that's another key thing. I'm gonna make another video to explain how women should clean their private part to avoid such situation if you find yourself having it repeatedly. Risk factors. UTIs are common in women. Many women experience more than one UTI during their lifetimes. Risk factors of UTIs that are specific to women include female anatomy. Women have a shorter urethra than men do. As a result, there is less distance for bacteria to travel to reach the bladder. Sexual activity. Being sexually active tends to lead to more UTIs. Having a new sexual partner also increases risk. Certain types of birth control. Using diaphragms for birth control may increase the risk of UTIs. Using spermaticidal agent also can increase risk. Menopause. After menopause, a decline in circulating estrogen causes changes in the urinary tract. The changes can increase the risk of UTI. Other risk factors for UTIs include urinary tract problems. Babies born with problems with the urinary tract may have trouble urinating. Urine can back up in the urethra, which can cause UTIs. blockage in the urinary tract, kidney stone, or an enlarged prostate can trap urine in the bladder. As a result, of risk of UTI is higher. A suppressed immune system, diabetes, and other diseases can impair the immune system, that is, the body's defense against germs. These can increase the risk of UTI. Catheter use. People who can urinate on their own often must use a tube called catheter to urinate. Using a catheter increases the risk of UTIs. Catheters may be used by people who are in the hospital. They may also be used by people who have neurological problems that make it difficult to control urination or who are paralyzed. A recent urinary problem. Urinary surgery or an exam of the urinary tract that involves medical instruments can both increase the risk of developing UTI. Now, we're going to look at the complications. Complications are when treated promptly and properly. Lower urinary tract infections rarely lead to complications, but left untreated, UTIs can cause serious health problems. Complications of a UTI may include repeated infections, which means you have 2 or more UTIs within 6 months or 3 or more within a year. Women are especially prone to having repeated infections. Permanent kidney damage from a kidney infection due to an untreated UTI. Delivery, a low birth weight or premature infant when a UTI occurs during pregnancy. A narrow urethra in men from having repeated infection of the urethra. Sepsis, a potentially life-threatening complication of an infection. This is a risk, especially if the infection travels up the urethra through the kidney, what we call backup flow, which is delicate for everyone. Now, let's look at prevention. These steps may help lower the risk of UTIs. Drink plenty of liquid, especially water. Drinking water helps dilute the urine. That leads to urinating more often, allowing bacteria to be flushed from the urinary tract before an infection can begin. Try cranberry juice. Studies that look into whether cranberry juice prevents UTIs aren't final. However, drinking cranberry juice is likely not harmful. Wipe from front to back. Yeah, this is another very important point. Do this after urinating and after a bowel movement. It helps prevent the spread of bacteria from the anus to the vagina and urethra. So I read this point again. Wipe from front to back. So it's very important. Women need to take note of this because men are not really involved. So wipe from front to back. Do this after urinating and after a bowel movement. It helps prevent the spread of bacteria from the anus to the vagina and urethra. Empty your bladder soon after having sex is also another important thing. Also, drink a full glass of water to help flush bacteria. Avoid potentially irritating feminine products. Using them in genital area can irritate the urethra. These products include deodorant, spray, douches, and powder. Change your birth control method. Diaphragms, unlubricated condoms, or condoms treated with spermicide can contribute to bacteria growth. So another key thing again is the type of underwear that you wear, or we'll call them pants. make sure that they are cotton pant and you check them also regularly. That is, if you have a cotton pant, it helps to absorb moisture that builds up down there. Otherwise, if you go and get any other types of material, moist builds up there and it gives room for bacteria to build up. Like so, you are prone to develop UTI frequently. So teenagers, ladies, people should know what I'm saying. Make sure the pant you wear or the underwear is 100% cotton. Otherwise, you find yourself in trouble. And now the last stage of this video is to give you people now the types of medication to use in this condition. So I see in my medical forum that so many healthcare providers, they put patients on quinolones, but that's crazy. Quinolone should be the last choice. In the US, Canada, Europe, all over the Western world, quinolone comes as a last choice. It cannot be first choice for UTIs. So that's my message to you people. Take it seriously. You should not prescribe quinolones immediately. That can only be used if there are no other choices. For instance, I'm to list now the first choice, second choice, third choice of medication that you can use in treating UTI. I will pronounce it slowly for you to follow up well. And here we go. Healthcare providers commonly prescribe the following antibiotics to treat UTIs. Number 1, nitrofurantoin. Number 2, sulfonamides. That is sulfur drugs such as sulfamethoxazole and trimethoprim. Third, or number 3, amoxicillin. Number 4, cephalosporin such as cephalexin. Number 5, doxycycline, which is one of the tetracyclines. Number 6, fosfomycin. And lastly, quinolones. Quinolones here means ciprofloxacin or levofloxacin. Any of these fluxes should be used in this case. Again, I do recommend you to prescribe the quinolones only as a last resort. That is, if you don't find all the other list of medication I just named. I am happy again to say this one more time. You make sure you start with nitrofurantoin. That's the best drug used for UTI all over the Western world, say in Europe, in Canada, and the United States, Australia, Japan. And if you don't find that one, you can now start thinking about sulfonamides. But if there's an allergy involved here, then you now switch to another class of medication, which is amoxicillin. Or you move to cephalosporins or doxycycline, which is part of the tetracyclines. And if you are on the tetracyclines, I will say do not take any dairy product while on this medication. Dairy product here means milk, cheese, and other stuff that comes from cows. So far, so good. My name is Dr. WAN, and I'm here to help you. You have my phone number, you have my YouTube channel. Please subscribe, like it, and share it with loved ones. All my medical students, please listen to this clip several times. It is part of your medical program, it's part of your training, and I see you becoming a great clinician when you go through my YouTube channel. There's a lot for you to follow. Thank you so much and have a wonderful day. I'm Dr. WAN. Ciao.